Medical tourism is becoming more popular, even among people who are getting non-elective surgery. Olga has the details.
Having surgery can be serious enough, and add to that worry, accessibility and rising medical costs. But many patients are now flying abroad for their surgery in order to save money. Medical tourism is growing, and our guest will explain the move behind that increase. Meet Dr. Luis Almodovar, a neurosurgical oncologist, and cardiologist Dr. Hilton Franqui, both from San Juan, Puerto Rico. Good morning.
Hi, good morning. Thank you for having us.
No, thanks for being here.
Good morning.
Dr. Franqui, let me start with you. You know, we've heard a lot about medical tourism, people going for elective surgery, but now we're talking about highly specialized procedures such as cardiology and oncology. What's setting that trend?
Well, in some parties, something about accessibility to the care that you can get here in Puerto Rico. In the mainland, there are areas that you cannot get an electrophysiologist, which is my specific specialty, and we have that readily available with a backup of a full cardiovascular care system.
And doctor, what are you saying?
Well, the combination of services that we give, it's also an access that some people don't have in the mainland. For example, I'm a neurosurgical oncologist, which means that I'm a neurosurgeon, but also I work very closely with other cancer-related specialists. Sometimes the access to that group of specialists at the same place is not easily found in the mainland. So that's one thing that we have that is great for patients.
All right, and we hear a lot of stories, so I'm going to ask you, Dr. Almodovar, best case, worst case scenarios that one should consider when traveling for oncology surgery, because that's a really serious one.
It is, but at the same time, it's also a very good opportunity to recover in a place that's very good. And best case scenario, you're out of there in 2 or 3 days. Worst case scenario, it all depends on the complexity of the surgery. But I would budget, let's say, a week, not because you're going to spend all that time in the hospital. If everything goes well, you might go home sooner. But it also allows you to have a full recovery and see me post-op and make sure that the wound looks okay, that everything is okay, and then you can go home.
And what about with medical technology constantly changing? You got to consider that too, right?
Sure, but we have a very good complement of medical technology available to us in Puerto Rico. You know, we give standard of care. We're board certified in all of our specialties. All of us are. And we have all the latest technology for radiosurgery, for radiation oncology, neuronavigation in the OR, intraoperative monitoring for taking out tumors. Even I operate on people awake, which is great. So I think that's one of the things that makes us a comparable service to any service in the country that can give those.
And Dr. Franqui, let's touch upon the fact that doctors in Puerto Rico follow the same healthcare standards as doctors here in the mainland. And you actually studied, I believe, here in the United States, right?
Yes, under Tufts University in Massachusetts.
Massachusetts.
So we have to follow the same guidelines, and we are accredited by the same institutions. So our medical schools are accredited by the medical schools here in the United States. And we take the same board examinations. So it's pretty much the same system that we have to follow, the same standards.
And the same thing that I asked Dr. Almodovar, a lot of patients are traveling also to Puerto Rico and abroad for heart surgery. So anything that one should consider before doing something like that?
Yes, when you're going to get heart surgery, that's a very serious procedure to have. So you want to make sure that you are going to a program that is very well established, that it has full support in all areas. It's not only the doctor who is going to be operating, but you need high volume, because the higher the volume, the lower the incidence of complications there will be. And also you want to make sure that you have all specialties, non-invasive cardiologists, interventional cardiologists, electrophysiologists, and a great nursing staff. That's very important.
And doctors, I'm going to ask you both this question because, again, we have to reiterate, you don't even need a passport to get to Puerto Rico. It is part of this country, for goodness sake. And what feedback do you get from patients when they leave?
They like it.
They love it.
They love it. The thing is, for example, they don't feel that they have sacrificed any kind of quality. For example, I trained at MD Anderson Cancer Center in Houston, and then I went to practice in Puerto Rico. And I was well taught, and I was there in Puerto Rico to deliver the services for them. So I think that they feel pretty satisfied, and that's great for us, and that's great for the patient too.
And doctor, let's also talk about the fact that the prices are much different.
It's definitely more affordable than here in the mainland. You can get the same quality, the same services for half the price that you get here. So that's special.
Definitely, and especially, for example, for people with brain tumors, taking the tumor out is only part of the story. And that means that the difference that you get from having the procedure done at a lower price also means that you save on the other treatments as well. So it's an amazing story for them.
And doctor, for our viewers out there who'd like to look into maybe going abroad and doing a surgery in Puerto Rico, what's the website?
starhealthcarepuertorico.com.
Thank you so much for your time. Dr. Franqui, you as well.
Thank you.
Again, the website is starhealthcarepuertorico.com. You can also visit our website, thebalancingAct.com. More information there as well.